My name is Ivana Boyd, and I am the Policy Associate at Citizens for Juvenile Justice. We are an independent, nonprofit organization advocating for statewide systemic reform to achieve equitable youth justice. We want to ensure that you and your loved ones are protected from COVID-19 and have asked your peers to help guide information that is accurate, culturally relevant, and easily accessible.
I am from Hyde Park, Boston.
I'm from Boston.
I'm from Revere, Massachusetts.
I am from Boston.
I'm from Randolph, Massachusetts.
And I'm from Boston, Massachusetts.
There are over 29.9 million cases of the novel coronavirus have been confirmed across the globe,
with the U.S. having the most cases of any country in the world.
Chelsea,
Lynn, Brockton,
Everett, Revere, Worcester
have been hit hardest by the COVID-19 pandemic.
Due to physical health reasons and socioeconomic factors,
Communities of color and low-income communities are at higher risk of infection.
Many of these communities have higher shares of frontline workers who risk infection by providing essential services.
These workers often only have access to lower quality health care or have no health insurance at all.
With folks living in crowded communities with low air quality.
This means that in the U.S., people of color and low-income people are more likely to catch COVID-19
and also have more severe symptoms if they do get sick.
What's being illuminated by COVID are the generations of structural inequities and disparities that have not been addressed in this country. The constant avoidance of representation, the constant avoidance of providing community infrastructure that can prevent disasters like this from happening. And so when we observe communities of color that are densely populated, that lack adequate resources, with underfunded education systems, poor recreational facilities, poor maintenance of public housing, this is not surprising to anyone. And we were unprepared for the ways in which it was going to highlight the incredible gaps and disparities and mistreatment in these systems. And who are the ones that are most impacted by this? Youth of color.
Symptoms include a fever, chill, coughing,
Sore throat, congestion, runny nose, shortness of breath,
headaches, body aches, fatigue, loss of taste or smell,
or stomach problems like nausea, vomiting, or diarrhea.
25 to 45% of people who have COVID don't even know that they're infected.
And catching COVID is as easy as standing near someone for 15 minutes, especially indoors, and if this person is speaking, coughing, or laughing without a mask.
So what can you do? First off, mask up and wear it whenever you leave home.
You have to get one with 2 or 3 layers of fabric that cover your nose and your mouth tightly with loops that can adjust.
Got glasses? Prevent fogging with a mask that bends closely around the bridge of your nose, like this.
And don't use those fleece masks. They actually break up the virus into smaller particles that more easily pass through people's masks.
and toss out those bandanas too. It is very easy for the virus to just go under your mask and up your nose. So basically, you're not wearing anything at all.
Don't use a mask with holes or vents. Are you trying to roll out the COVID red carpet?
And it's easy to use soap and hot water to wash your mask by hand. So I start on the inside and I wash it for 30 seconds. I hold it by the edges like this. And I turn this off and I squeeze.
Make sure it's dried all the way through before wearing it again.
If you wear a single-use face mask, make sure to dispose of it properly. Snip the ear loops in half with a pair of scissors, so there's less of a chance it could get tangled around an animal.
Wash your hands with soap and water many times during the day, especially when you arrive at home or are about to eat.
You can reduce transmission of this illness by avoiding close contact with your people. Limit your time in public spaces or crowds when using public transit. Try to keep at least 6 feet from other passengers or transit operators.
Another way to stay healthy, ventilation. Keep airflow high as to decrease your chances of inhaling the virus and getting sick. Moving gatherings outdoors, open doors and open windows, and use air filters if you can.
The social isolation that comes with staying safe from this pandemic is another thing we need to keep in mind for ourselves and our loved ones.
And physical distancing doesn't mean necessarily disconnecting from each other. In this time, it's more important than ever to keep the bonds between us strong.
I also made a group chat with all my cousins and all my family members, and that helps me see how everyone's doing and see if everyone's okay.
Okay, so if you're feeling sick or come into contact with someone who is, call your doctor to see if you should get tested and self-quarantine for 14 days.
Massachusetts has many free and low-cost options for COVID-19 testing. Call your local public health department or use this interactive map located on the MassGov website to locate a test site.
Call ahead to see if they require pre-screening, a referral, and/or an appointment.
Going to your doctor or to the ER can feel extremely scary right now, but don't wait to get care if you need it, COVID-related or not.
If when you go to the doctor or the hospital and you are experiencing things that make you feel like you are not getting quality and equitable care, that is a problem. And there's a number of different avenues that you can take. I think number one is having a primary care physician. This is a generalist doctor that specializes in you and specializes in making sure that they are in tune with what your needs are. Number two is if you're not satisfied with the care that you're getting in that encounter, I encourage you to ask questions. If you're not understanding either medical language that a provider is using, ask, what do you mean by that? Lastly, if there is a language barrier, you are entitled to an interpreter. The medical team should get an interpreter for both yourself and your loved one in whatever language is the primary or language that people are most comfortable with. And if everything cannot get done in one visit because of time constraints, request another visit.
If you have people in your life who refuse to take the needed precautions to stop the spread of COVID-19, try to respond with empathy.
When people are told they are doing something wrong or bad, they tend to get defensive and shut down.
Schools are reopening differently to be safe, but that also means that schools must be sensitive to student behavior that happens because they have a disability or are experiencing stress in their lives. Some students will have a hard time following the new COVID safety rules. Students will struggle because of the stress of the pandemic and being in remote learning. But all students have a right to a free and quality education, and that means that schools have a responsibility to find ways to make sure that even students who are struggling can access a good education. But sometimes, instead of supporting a struggling student, schools instead discipline a student for their behavior. If you are disciplined because you weren't able to follow the COVID safety rules, or because your behavior was the result of the stress you were feeling, or even if you were suspended or expelled and weren't allowed back in school, even remotely, you can call or go online to get help from free legal services who can help you make sure that your education rights are protected.
Imagine being a young adult and you're dealing with so much in your life. You're tied to a system where there's clear collateral consequences and you're fully understanding what that means as you transition into adulthood. You are bouncing from foster placement to foster placement. So there's this internal sense of, well, nobody wants me. Am I good enough? And then you're dealing with the anxiety of where am I going to sleep tonight? The potential of being homeless, the potential of being commercially, sexually exploited, the potential to be a victim of harm or trauma, because this is all they are already traumatized, or just the exacerbation of trauma. And now in the middle of all of this, we say, go to school, pay attention, as if it's easy, and it's not.
Homeless students, foster students, and children whose parents are in the military have even more protections because they face so many barriers to their education. The Ed Law Project specializes in the education rights of children who are in foster care or who are involved with the legal system. We are here to help.
If you're facing an eviction, it's important to get help. There are ways to protect yourself and stand up for your rights. For information about your rights and where to find a lawyer, you can go to www.masslegalhelp.org. If you need help paying rent, you can go to www.mahousinghelp.com. If you're in court and you're facing an eviction, ask for a lawyer. If English is not your primary language, you have the right to an interpreter. Ask for an interpreter. Do not let others stop you from standing up for your rights. This is a problem for young people in foster care and those who have left foster care. There is help available, both in the form of help to pay for housing, as well as help with other forms of income. The best way to access these supports is to ask the adolescent outreach worker in the DCF area office overseeing your case. That's the same office where your social worker works from when your case was open. You can ask about housing vouchers available through the Federal Foster Youth to Independence Program, which provides housing vouchers for young people aging out of foster care and are at an extreme risk of being homeless. You can also ask that same adolescent outreach worker about receiving your discharge support program payment. These funds are available to youth up to age 22 or 23 and can cover room and board expenses like rent, security deposit, furniture, and even transportation. These payments can go directly to you or to your landlord. You could also try your local housing authority and let the worker know that you're a former foster youth and ask if they have any housing vouchers available for someone in your situation.
The legal system is working to respond to the challenges of the COVID-19 pandemic, but that does not mean young people don't get arrested or even incarcerated. If a young person is charged with a crime, the police, when possible, are avoiding an arrest by handing a summons, which is a court order that requires the young person to appear in court. When that's not possible, the young people they arrest may be held overnight or even over the weekend while they await their arraignment or first court appearance, along with their bail hearing before a judge. At the bail hearing, the judge can decide to hold a young person on a high cash bail and considers several factors, including the type and seriousness of the alleged offense or crime. Whether a young person is detained or not, they can still face criminal charges that they must answer for if they're rearrested during the process of the court case, and they have pretrial probation conditions, which can include stay-away orders, GPS monitoring, and home confinement. If a young person is adjudicated delinquent or found guilty of any charges, it creates a juvenile or criminal record, and the young person will be subject to either probation conditions or at times incarceration. Now, all courts are currently open with physical distancing restrictions. For young people that are not held in DYS custody or in a county jail, depending on the court location, they either have to physically go to court or appear for their court hearing on video. Due to the pandemic, the court is making difficult decisions on which cases move forward and which are being delayed, and there are repercussions for both. If a young person is held in DYS custody or at a county jail waiting for a trial, they must now be quarantined and isolated from others for the first 14 days. Each time that young person is transported to a court hearing and they return to custody, they must repeat the quarantine and must be in isolation for 14 days to limit any pretrial spread of COVID-19. For young people that are detained, it's really hard being in isolation, disconnected from family and friends, and even harder to face these consequences with significant delays to their cases. Because court cases are moving slower, some young people are locked up for a longer time than they normally would have.
At the end of the day, you're responsible for keeping yourself and those you care about safe. You can also decide if it may be best to distance yourself from that person to protect yourself.
When you're scrolling through social media and you see a news article posted by your uncle dropping the latest facts on COVID, always double check those facts. Many of us instinctively hit that share button before even think to ask, is this real?
Many accounts online are run by sketchy folks or even bots with unknown intentions, and they're really good at faking you out.
For example, many trolls on Twitter will use a stock photo of a black woman as their profile because they know black women are some of the most influential people on social media.
So don't feed the trolls or share unverified info.
Please share this video with your friends and loved ones so we can keep each other safe and healthy.